doctor who, in my opinion, was most responsible for saving Mr. Scalise's life is an interventional radiologist.
You are now listening to Saralgar MD.
Alright guys, today on Saralgar MD, we're going to be talking about IR in the news. By now you've probably heard about the Scalise shooting incident. Stephen Scalise is a Republican member of the House of Representatives. He's the majority whip. He and several other congressmen were practicing baseball for an annual charity baseball game on June 14, 2017 in Alexandria, Virginia. At that time, a left-wing anti-Trump activist named James Hodgkinson rushed at them and fired using a semi-automatic weapon called an SKS. This is a rifle that has similarity to an AK-47. Mr. Scalise was hit by a bullet in the hip, and that bullet traveled deep into the pelvis, fracturing bones and damaging blood vessels. He was immediately rushed to MedStar Washington Hospital, a huge 900-bed facility that has level 1 trauma resources. Upon his arrival, he was in hemorrhagic shock. His bleeding was so significant that his blood pressure had decreased and his heart rate had increased in order to keep up the supply of blood to critical organs. So first off, really, this is a terrible thing. Terrible for many reasons. Terrible because an important, hardworking member of society was seriously injured for no good reason in a very cowardly way. It's sad because it further reiterates the reality of a very serious political tension in our country at this time. And it's sad because it's another reminder of this recurring theme of gun violence in our country. Well, I'm not really here to tackle those issues, but I'll tell you one thing of interest from the story to me personally is that the doctor who, in my opinion, was most responsible for saving Mr. Scalise's life is an interventional radiologist. So Dr. Sava, the trauma chief at MedStar Washington Hospital, held a press conference where he talked about each and every physician involved in the care of Mr. Scalise. He does mention at one point in the OR they had difficulty controlling bleeding, and at that point they urgently transported the patient to the IR suite for further care. At this point, Dr. Arshad Khan helped to treat Mr. Scalise and was able to control life-threatening bleeding in the pelvis. So, who is Dr. Khan? He's an interventional radiologist. He's a fellow of the SIR. Per his online profile, he completed multiple fellowships ending in 2000 and has been in practice since then. So, what's the procedure that Dr. Khan did? Well, in general, I would say he performed an embolization. Now, the details I'm not clear on, but I can probably tell you what occurred. He probably stuck the right common femoral artery in the groin, probably did an aortogram to look at the pelvis and look for arteries that are bleeding within the pelvis, and then he probably used smaller catheters to select out branches of probably the internal iliac artery, found areas of bleeding, and then controlled them using either glue or coils or possibly using gel foam. Now you may wonder, well, the patient was in the OR, why couldn't that bleeding have been controlled surgically? It is true that all surgeons have various methods that they use to control bleeding intraoperatively, because controlling bleeding is really a huge part of what they do as part of the surgery. The problem is that when there's multiple sites of bleeding, it is hard to physically visualize and treat all those areas because blood obscures your ability to directly visualize bleeding blood vessels. Now contrast that to what we do in IR. In IR, we routinely use an type of imaging called DSA. That stands for digital subtraction angiography. Now the part that is subtracted out is really everything in the body except for the blood vessels. So when we're doing our imaging, all we're seeing is the blood vessels, and we can pinpoint exactly where the bleeding is. And then using our small, delicate instruments, we're able to guide our catheters to that site of bleeding and then treat it using the various methods I talked about, basically glue or coils or possibly using gel foam. So really our abilities to control bleeding are really extraordinarily superior to surgeons in this regard. That's why every trauma hospital is going to have some sort of endovascular specialist, usually an interventional radiologist, available on call to help them when they're trying to treat life-threatening bleeding. So I'm really sad that Mr. Scalise was hurt in this despicable fashion, but I'm glad that he was quickly helped. I'm glad that he's currently listed in fair condition. And I'm really interested and excited by the fact that it was an interventional radiologist that was really key to his quick turnaround in health. So check out this story on Mr. Scalise. Check out Dr. Arshad Khan and what he's done in interventional radiology. And check out the press conference by Dr. Sava and how he talks about how a team is assembled to take care of a patient in life-threatening hemorrhagic shock. If you have any questions, feel free to drop me a line. Saralgar MD, stay safe. Thanks for watching. Take care.